WHO just cut the Hondius cluster to 10 confirmed cases, and the contacts from that ship are now spread across several countries.
This is hantavirus watch. And if you were on the Hondius, or you know somebody who was, you need to hear this one.
We're going to separate what WHO has actually said from what people are assuming, because Andes virus is the strain that matters here, and the treatment and vaccine picture is still very much in progress.
And there's that New Zealand passenger who tested negative in Taiwan, which brings us to the weird part. Negative, but still isolating. We'll get into what that means for the contact tracing picture.
Here's SIDRAP.
The World Health Organization, WHO, today reduced the number of reported hantavirus cases from the Dutch cruise ship MV Hondius from 11 to 10. WHO officials said at a press briefing this morning that the 11 cases reported in a disease outbreak update on May 13th included one inconclusive test in a passenger from the United States. But the agency learned yesterday that the patient has tested negative.
WHO walked one case back today. The Hondius total goes from 11 to 10, because that U.S. passenger flagged on May 13th turned out negative. So right now, it's 8 confirmed and 2 probable. And yes, that difference matters.
And 41 Americans are being monitored by the CDC, plus more than 120 total passengers who got off in Tenerife and are now back in their home countries. At that point, it's not a ship issue anymore. It's a contact tracing problem stretched across a bunch of health systems.
Tedros was very clear about the 6-week incubation window, and he said new cases in that window do not automatically mean the outbreak is expanding. They can mean the surveillance is actually working. That's an important distinction.
Sure, but if you were on the Hondius and you're 2 weeks home feeling fine, you still have a lot of watch time left. So when does an exposed person stop waiting and actually get seen?
From Associated Press.
The U.S. Centers for Disease Control and Prevention said that at least 41 people in the United States are being monitored for potential exposure linked to the MV Hondius, including 16 passengers currently in the National Quarantine Unit at the University of Nebraska Medical Center in Omaha. One person who had been in the hospital's biocontainment unit after initially testing positive was moved to the quarantine unit with the other passengers after subsequent test results were negative.
As of May 15, WHO is counting 10 cases tied to the MV Hondius. 8 confirmed, 2 probable, 3 dead. The Director General called the global risk low, and that's the official line, not a guess.
And right now, 41 Americans are being monitored, 16 of them in the National Quarantine Unit in Omaha, and 2 more at Emory in Atlanta. Those are real places, real itineraries, real zip codes, not some vague being monitored language.
One thing worth flagging. The person moved out of biocontainment after an initial positive test was moved because the retest was negative, not because symptoms had cleared. Those are not the same thing, and CDC's own reporting keeps them separate. From r/medicine, 80 upvotes.
These incubation periods are so long. They should test all of them. Could give information on asymptomatic cases. If this kindling goes up in flames, I think the smoking gun will be the lady who decompensated in the Johannesburg International Airport on a plane crumping for 1 hour, then flew into a major European city. We should learn from underestimating a virus we didn't understand just a few years ago. Assume the worst and take maximum precautions. The cost of being wrong about this is too...
I hear the transmission point, but the incubation period issue is real. If they're not testing asymptomatic contacts at Nebraska right now, then we're basically guessing at the case count.
From r/World News, 628 upvotes.
So my major concern isn't a pandemic or epidemic, but rather that they are basically transporting an especially contagious version of hantavirus into places where it isn't endemic, and it could be transmitted to rodents in these places, especially where there are rodent issues like dense cities, i.e. Chicago or New York. This could cause it to become endemic in the rodent population and lead to playing whack-a-mole every time sustained human transmission starts back up.
Okay, the rodent reservoir spillover angle, Chicago, New York. That is a totally different threat model from pandemic spread, and it's not getting enough airtime.
It's a fair hypothesis, but we still don't know which strain is circulating on the Hondius. Andes virus has documented person-to-person transmission. Sin nombre and sol do not behave the same way in rodent populations here. So strain identity has to come first. R/medicine, 264 upvotes weighing in.
Mildly PCR positive? Is that like slightly pregnant? I'm just glad the CDC is fully staffed, under expert leadership, and ready to work closely with the top researchers at the NIAID and to cooperate fully with the WHO.
Mildly PCR positive is doing a lot of work in that CDC update. A CT value or a viral load threshold would tell us something. A qualitative hedge tells us almost nothing clinically.
The second half of that post is doing something else entirely, and I'm just going to leave it there.
From RNZ News.
The Taiwan Centers for Disease Control says a New Zealander on board the cruise ship struck by hantavirus has tested negative. One New Zealander left the ship on St. Helena Island in the South Atlantic last month, before the deadly hantavirus outbreak was revealed. The Centers for Disease Control said the passenger entered Taiwan on 7th May and has reported no health issues.
Taiwan CDC confirmed May 7 entry, and both blood and urine were negative for hantavirus. So infection is ruled out. But because this passenger got off at St. Helena before the outbreak was even announced, they're still classified as a high-risk contact and staying isolated until June 6th.
St. Helena, South Atlantic last month. That is one long itinerary tale. If I got off that ship thinking I dodged it and then wound up in a Taiwan hospital until June 6th on a negative test, I'd want a very clear explanation of why the outbreak wasn't flagged sooner.
Taiwan CDC is taking weekly specimens through the end of the monitoring window. So that's not a throwaway, no cause for concern line. It's a real surveillance protocol for a high-risk contact with a negative result, which is exactly the right move given hantavirus incubation.
Most people know hantavirus as the thing you catch from mouse droppings in a cabin. So what makes the Andes strain different, and why does a cruise ship change the risk math?
Great place to start because these are really two different stories. Hantaviruses as a family are rodent-borne. You usually get exposed by inhaling particles from infected rodent urine or droppings. And that's the Sin nombre strain most Americans think of in rural Southwest cases. The Andes strain, which is what's circulating on the MV Hondius, comes from the same basic rodent reservoir in South America, but it has one property no other known hantavirus has. It can spread directly from person to person. Per the ECDC, Andes virus is the only hantavirus strain documented to transmit human to human, and scientists are still working out what makes it biologically capable of that. WHO's Disease Outbreak News says the Hondius cluster fits that pattern. The current evidence points to 1 or 2 people infected on shore in Argentina, who then passed the virus to fellow passengers on board. As of mid-May, at least 11 people on the ship had contracted Andes virus, and 3 had died, with illness marked by fever, rapid respiratory deterioration, and hantavirus pulmonary syndrome, or HPS. Science News reporting by Tina Hessman-Say says this cluster is now one of roughly a dozen documented person-to-person transmission events in the scientific record. A rare but real phenomenon. And the 2018 Epuyén, Argentina outbreak, which killed 11 people after spreading at a birthday party, is what first put researchers on alert.
So if person-to-person spread is the key variable here, does a closed setting like a cruise ship make that risk meaningfully higher than, say, a village outbreak on land?
That's exactly the question driving the international contact tracing response right now. NBC News reports that the latest confirmed cases on the Hondius are all among people who had direct contact with earlier patients, which fits close contact transmission rather than easy airborne spread. The CDC says the overall risk to the American public remains extremely low, and a Stanford medicine infection prevention specialist has said flatly that hantavirus is not capable of causing a global pandemic. What we should watch is whether any of the 18 Americans now in U.S. quarantine facilities or contacts in other countries develop symptoms. That case count data is going to be the clearest signal of how efficiently this strain is moving beyond the ship. Maya Tostonik, writing in CBC News,
Infections can be deadly, and there is no dedicated treatment for hantavirus. Researchers around the world are working on a hantavirus vaccine, though they say development is in the early stages and rollout could be years away.
To be precise about the treatment picture, there is no approved antiviral and no licensed vaccine anywhere in the world right now. The CBC piece puts the case fatality rate for hantavirus pulmonary syndrome, the Americas variant, at up to 40%, and researchers are calling vaccine development early stage, with rollout still years away.
So the cruise ship outbreak hits, people are understandably alarmed, and the honest answer from the medical community is supportive care and hope for the best. That 40% number is not a footnote. That's the ball game if you get a severe case.
The transmission biology matters, though. Rodent droppings, urine, inhaled particles. Human-to-human spread for the North and South American strains is not how this moves, which is why years away from a vaccine is a research funding story, not a contagion control emergency. If Hantavirus Watch helps you stay informed, take a second to subscribe and leave a review wherever you're listening. It's a small thing, but it helps other people find the show too. You'll find links to every story we covered today in the show notes. If one caught your attention, it's there for a closer read. That's Hantavirus Watch for today. This is a Lantern podcast.